the Democratic Republic of the Congo announced today that a new outbreak of Ebola virus disease has been detected near the city of Mbandaka in Équateur province. The announcement follows a complex Ebola outbreak in eastern DRC, which seems to be in its final phase. The new one is on the other side of DRC, western DRC. WHO will continue supporting DRC in tackling Ebola as well as responding to COVID-19 and the world's largest measles outbreak.
The government of the Democratic Republic of the Congo announced today that a new outbreak of Ebola virus disease is occurring in Wangata Health Zone, Mbandaka, in Équateur province. The announcement comes as a long, difficult and complex Ebola outbreak in Eastern Democratic Republic of the Congo is in its final phase, while the country also battles COVID-19 and the world's largest measles outbreak. Initial information from the Ministry of Health is that 6 Ebola cases have so far been detected in Wangata, of which 4 have died and 2 are alive and under care. 3 of these 6 cases have been confirmed with laboratory testing. It is likely more people will be identified with the disease as surveillance activities increase. This is a reminder that COVID-19 is not the only health threat people face, said Dr. Tedros Adhanom Ghebreyesus, WHO Director General. Although much of our attention is on the pandemic, WHO is continuing to monitor and respond to many other health emergencies. This is the Democratic Republic of the Congo's 11th outbreak of Ebola since the virus was first discovered in the country in 1976. The city of Mbandaka and its surrounding area were the site of Democratic Republic of the Congo's 9th Ebola outbreak, which took place from May to July 2018. It's happening at a challenging time, but WHO has worked over the last 2 years with health authorities, Africa CDC and other partners to strengthen national capacity to respond to outbreaks, said Dr. Matshidiso Moti, WHO Regional Director for Africa. To reinforce local leadership, WHO plans to send a team to support scaling up the response. Given the proximity of this new outbreak to busy transport routes and vulnerable neighboring countries, we must act quickly. WHO is already on the ground in Mbandaka supporting the response to this outbreak, as part of capacity built during the 2018 outbreak. The team supported the collection and testing of samples, and reference to the National Laboratory for confirmation. Contact tracing is underway. Work is ongoing to send additional supplies from North Kivu and from Kinshasa to support the government-led response. A further 25 people are expected to arrive in Mbandaka tomorrow. WHO is also working to ensure that essential health services are provided to communities despite these emergency events. The Democratic Republic of the Congo's 10th outbreak of Ebola, in North Kivu, South Kivu and Ituri provinces, is in its final stages. On the 14th of May 2020, the Ministry of Health began the 42-day countdown to the declaration of the end of that outbreak. New outbreaks of Ebola are expected in the Democratic Republic of the Congo given the existence of the virus in an animal reservoir in many parts of the country.
It is big and barely governable, and Ebola has taken hold in the Democratic Republic of the Congo. The aid agencies and local officials are waging war on the virus, but they're losing the fight. They cannot contain the disease. So organizations like the World Food Programme have ramped up their response, and we joined them in an armed convoy as they ventured into territory held by local militia.
The situation here is very volatile and can change from 1 hour to another. We need to always reassess the situation.
It's a hotspot, and the WFP hasn't been here before. The aid agencies have to expand their operations and win support from those on the ground.
We're going to meet the local chief. We're visitors here and we need his permission to be here.
Health workers are frequently attacked by Congolese who don't believe Ebola exists. But the local chief assured us we'd be able to travel safely. 30 kilometers up the road, we reached a distribution center where hundreds were queuing up for food. And there was something special about this group. Each one has been in direct contact with a victim of Ebola. They're all considered high risk. Blaise Mahamba pleads with villagers to keep their distance, where Ebola is spread by spit and sweat.
Can you stop it? Can you stop the spread of this virus? Is it possible?
Oui, c'est possible, c'est pas des sensibilisations que nous allons vaincre. C'est pas des sensibilisations. Parce que le début n'est pas comme aujourd'hui. Le début c'était autre. Parce que les gens fuyaient dans la forêt. Mais actuellement, les gens s'amènent.
The WFP is using food as its principal weapon. With a sack of rice and beans, the villagers of Aloya are less likely to travel. They're less likely to spread the virus.
You feel scared sometimes?
Ndio. Hii malali iko na boka juu haichaguake mtu. Ikaingia mkakaa tu azare mnaisha.
More than 60 have died from Ebola in this village. 3 suspect cases were detained in this shack one morning on a visit. They were taken to a treatment facility where doctors work in specialist rooms called cubes. But there is no cure for this infection. The majority here die.
Well, we're heading over to the cubes now. The doctors, they've got no more beds left in this place. The facility is absolutely full. And the suspect cases, well, they don't bring them here anymore. They're all assessed on the other side of the road. I really can't think of a more challenging or a more tested place to work.
More than 1,650 people have lost their lives to Ebola since the virus took hold. But there is reason to hope. This baby, nicknamed Jeremy, was born in a cube, and doctors think the child and his mother may survive. But they'll need extraordinary support, like the country they live in, if they're going to recover from Ebola. John Sparks, Sky News, Benny.